Watch this entire video. You will never forget GCS again. Here we go. Hey everyone, Paramedic Coach here. I got another NREMT practice question for you. Then we're going to go over and understand GCS cold. Make sure to hit like, smash, annihilate that like button down below, hit subscribe, and let's unveil the question. So you are called to an 84-year-old female who has fallen. Now, she's speaking with scattered words, okay, inappropriate words, withdraws from pain, and the eye opening is found on your verbal command. What's the GCS? Start the clock. 5, 4, 3, 2, 1. The answer is it A, 10, B, 13, C, 12, or D, 9? What do you got? Put your answer in the comments down below. And the answer is, here's why it is 10, A, 10. Now, she is speaking with scattered words, inappropriate words, meaning that's 3. 3 points. That's the verbal. Withdraws from pain is the motor. That's going to be 4, okay? Now, eye opening on verbal command, that is a 3. 6 and 4, we got 10. There's 10. Now I want to show you how to never forget GCS ever again. GCS 456. EVM 456. That's the mnemonic for you. When you think of the Glasgow Coma scale, when we think about this, what I want you to think about is EVM 456. I also want you to think of 111. Let me explain this. Now, we have 3 sections, okay, and you can see right here I have it built up for you. We have here the eye-opening section, the verbal response section, and the motor response section. That's the EVM, okay? Why do I say 456? Because the top number in the eyes is 4. Top number in the verbal is 5. Top number in the motor is 6. Why do I say 111? Because each unresponsive is a 1. So what does that mean? Well, what that means is 15 is a perfect score. That is a patient who, like right now, I'm 15 right now. A patient who is in cardiac arrest would be a 3. So we have someone totally unresponsive to 3. Alert and oriented person is all the way over at 15, right? Simultaneous eye opening, obeying commands, or an oriented 15. Once we know 15 and 3, all we need to do now is understand the middle, and we got it cold. Now, the patient we had in the question, she had eye opening to verbal stimulus. She got 3 points. Then she had inappropriate words, so she ended up at 3. And then withdrawals from pain was 4. That's how we got to 10. Now, I'm going to break this down so we can always remember this, okay? Now, hear me out. We have the top and the bottom number set in each one. So let's break down the middle piece. So with eye opening, we go from spontaneous eye opening, which is you walk up to the patient, their eyes are open. If you, because they call out their name, that would be a verbal stimulus, right? And their eyes open then, right? That would be a 3. If you try to call their name and their eyes don't open, let's say you did a sternal rub, right? Or maybe you pinch their finger, right? Painful stimulus, then their eyes open up. Okay, that's 2. If none of that happens, it's a 1, right? So we think here, the eyes are open, we talk to patients, painful stimuli, or unresponsive. That's it. So that's the first section, done. Next section, verbal. We have complete unresponsive, again, think like cardiac arrest, and then me right now, or an oriented. Now, what's one step down? Well, what I think about is like a dementia patient. They're fine, but they're confused, right? This is the confusion level. They're speaking in full sentences, they're just confused. They just are not aware of what's going on. That's confusion. That's 4 points. Now, these 2, there's no reason to mess these 2 up, but everyone forgets them. Here's what it is. So confusion means I'm speaking in full sentences, but I'm unaware of what's going on. I'm just confused. Right? Think about, like, again, a dementia patient. Inappropriate words means that, let's say you're asking a patient a question and there are just random words. It does not make any sense as far as a conversation, and also can be looked at as just random 1 to 2 words being spewed out, right? You're able to understand it, but it's inappropriate to the actual situation. But you're getting words out. That's inappropriate words. Now, number 2 here, before I'm responsive, I want you to think sounds, not words. Okay, that's how I remember it. So we're still getting out words here at 3. And number 2, it's grunting, it's just noises, right? So your verbal, you're still able to make some sort of speech, but it's not words, it's not sentences, you're not confused, it's just noises are coming out of your mouth. It is sounds, not words, it's noises. Ones are unresponsive, nothing, okay? So we can picture that patient as they go down to unresponsive, right? Words, sounds, confusion. Confusion, words, sounds. That's how you remember it. Now motor, we got 6 obey commands, 1 unresponsive. Let's fill in the middle. Now, this has to do, this actual part, with a painful stimulus and how the patient responds to a painful stimulus, right? So if they obey commands, okay, 6, 1 unresponsive. 5 means the patient is able to localize where the pain is. So let's say they have an arm injury, they can say, oh, my arm, they're holding their arm, they can feel the arm, right? They're not obeying commands though. Localizes pain. Withdrawals from pain would mean, let's say you were storing an IV in the patient and they started to pull away, and they pull away, they're withdrawing from the pain, so they can still sense that, right? But they're moving away from it, withdraws from pain. Now there's 2 fancy ones, if you will. Abnormal flexion and abnormal extension. Now here's the best way I can describe it to you. If you go up to, let's say you go up to your patient, decorticate posturing towards the core. So what I have is an abnormal flexion. Well, extension is out like this. Flexion is in like this. So I'm going to flex in like this. This is the actual decorticate posturing. It's something like this. Okay? Now, the other one here, the abnormal flexion, which we have here, the cerebrate, is like this. So you can't see my wrist, but I'm going to move my wrist out like this. See how the normal, I go like this, bring them to the side, and I'm extending, and I'm like this. That is the maneuver. So we go decorticate, 3, 2. This is the posturing of the patient. 1, unresponsive. Right again, think a classic cardiac arrest. Try to put it in your head. So we go down from that, obeying commands, localizing, I see where the pain is, I'm just withdrawing from the pain. We have a decorticate posturing, we have a decerebrate posturing, and then we have unresponsive. And there it is. Congrats on getting through this GCS video. If you are someone getting ready for school, maybe you're in school right now or getting ready for your NREMT exams and you want to learn more and get this information, EMS education, down cold, I want you to hit the first link in the description. I'll give you a lifetime access right now to my video vault. It also includes our community group, student group, where you can ask me questions while you're in school, while you're studying. I will see you on the inside there, and I will see you in the next video. Take care.